You get a countdown.
Uh, 5, 4, 3, 2, 1. We are live on Facebook. The doctor is in for a special Sunday episode. We don't do this often, but we are here with our great friends from blood density, breast density matters. So
High density matters. Yes.
my density matters. And I actually named the episode Black Breast Density Matters.
I
But
love
we're
it.
going to talk about breast density. It's kind of breast density season. And so we have our dear blessed friend, Leslie Ferris Yergo, who's been a friend since we started, really, and her good friend, Dr. Randy Moss. Dr. Mo is on our way to Cairo. So Dr. Randy, you are the doctor in the house today. So we're glad you're here. And I think we actually are airing live at an event that My Density Matters is having in Chicago. So you want to welcome your friends?
Absolutely. Shout out and welcome to everybody at Vanderpool Humanities Academy in Beverly in Chicago. I hope you guys are having fun, some good food, taking our breast cancer screening guide, getting a personalized breast screening plan for yourself, and just having some fun. I hear there's going to be some line dancing later, so all good on that. So love the fact that we're doing double duty. We're live on Facebook and we're also hopefully streaming into Vanderpool. So very fun for us today.
Great. How many people are there at Vanderpool?
We're thinking it's about 60, 65.
Oh,
so
that's awesome.
Good crowd.
That's awesome. That's awesome to do live and virtual. So cool is that. So
absolutely.
So, I think it would be really great if you would start with your story, Leslie, because your story kind of tells the story of why breast density is so important. You know what I mean? And some people have heard it on our show before, but you should tell your story because I had never heard of it before till I was sick, right?
Yeah.
Right. But
and neither had I. So I was diagnosed with stage 4 breast cancer in September of 2017. So we're talking over 7 years.
You go, girl. You go, girl.
I know.
Isn't that so
yeah,
awesome?
I feel kind of sassy about that a lot. But I'm okay. But harsh reality of it is most people 7 years after their diagnosis stage 4 cancer are not okay. Okay. And so my whole existence now really is to empower women to find out their breast density and learn their additional options and advocate for themselves. Because right now, what we may need as women with breast density is not readily available to us all the time. And it varies by what doctor you see, what state you're in, what laws, you're subject to, what doctor you talk to, which medical board you listen to for your recommendations of screening. So it's all a big state of confusion out there. Can you hear me? Yeah.
And how old and how old you are.
Oh, I mean, yeah, you're so many variables in the recommendations that it's nuts. But what we come through at My Density Matters about is advocating for ourselves. That's kind of where we are right now. We have to learn, we have to understand, we have to advocate for ourselves, not just for breast density, but really for everything. And so we figure if we can teach people to advocate about breast density, it'll flow into other things, which is kind of, cool too. So, I mean, that's my, we talked about our whys before, Ricky, like, why do we do this? Like, there's a beach calling my name somewhere, but I'm not going to it until, more people are getting what they need, because this is something that needs to change in this system. And I just want my story never to be told again. And until we change, it will be.
It will be.
It will
be.
It's
your God job. It's like, it's on my God job. It's your God job.
Yeah.
God left you here to tell the story. And so what happened though? When you got diagnosed, like at what point did they say, oh, you have dense breasts?
Not till after I was diagnosed. So I never even saw it on imaging until I got a full body PET CT and they were looking for the metastasis. So everybody's wondering how that happened. So I'll give the really short version of it. I got a DEXA scan That is not a breast cancer screening tool.
No, that's a bone scan.
This is a bone scan. I was 55, postmenopausal. My doctor was like, let's see where you are, you know, bone density wise, not breast density, bone density. And the radiologist, Dr. Miles can probably relate to this, saw something real like odd in that DEXA scan. And so I got an x-ray, and then I got a CT, and then I got tests for multiple myeloma because that's what it looked like. And then ultimately they did a bone biopsy, and this is big, you know, the huge bone in your hip. And it came back metastatic breast cancer. And that was 2 months after an all clear mammogram. And so that was scary. I got a second opinion. I got a full body PET CT, and there they could see this big honking thing. It was lobular, so not a lump. And so that's how it happened. And that took 6 kind of harrowing, awful weeks.
Yeah.
And that's
So interesting. They found the tumor in your hip before they even found the tumor in your breast from a bone scan, right?
Incidental finding, right, Dr.
Wow.
Miles? That's what they call it, an incidental finding. And so that's what happened.
Wow,
and so that's why My Density Matters exists, and that's why we do what we do, because this is not a story that should be told.
Yep. So Dr. Miles, I'm going to call you Dr. Randy. Sorry, that's what I always call the doctor. But Dr. Randy, what exactly is breast density? Can you just explain it?
First, I'll just say thank you for inviting me to be a part of the show today. Leslie, there's so many points that you made during your story that I'm hoping to get back to, just to kind of help educate you know, women here. So breast density, you know, breast density is basically something that the radiologist looks at, someone like myself, when we interpret your mammogram. So women, you have fibroglandular tissue in the breast, which basically is just tissue that is like fibrous, and the glands that normally occur in the breast, that's considered fibroglandular tissue.
What does fibrous mean?
Just the fibers that hold up the breast and hold the structure of the breast. Some women have a little bit more fibrous tissue than others. So you have this fibrous or fibroglandular tissue, and you also have fat within the breast. So that ratio of fibroglandular tissue, which consists of those fibrous tissue and those glandular elements, to the fatty tissue within the breast, that determines your breast density. So if you have more fibroglandular tissue than fatty tissue, you're considered to have dense breast.
Okay. So, can I show the picture I found?
Yeah, let's show the picture, and we can
kind of the picture is worth 1,000 words. I think it's great to see that.
Yeah.
One thing I do want to point out is that, you know, dense breast tissue, it's not a disease. It's not something you can take a pill for or anything like that. It's just, you know, that's just how your body works. You know, it's just, you know, you may have dense breast tissue or you may not have dense breast tissue. As a radiologist, the doctor that reads your mammogram, we have to categorize your breast into a breast density category. So women who are in this A and B category, so A meaning fatty tissue or B scattered fibroglandular tissue, they're considered to not have dense breast. So let's look at A, and let's look at, you know, you know, almost entirely fatty breast tissue. If you look at that screen, as you look at the breast there, you can see that it's mostly lucent or clear with very little white lines. So those white lines within the image, that is the fibroglandular tissue, or that fibrous tissue that I mentioned, whereas that clear or the black area within the breast, that's just all fatty tissue. If we look at C and D, heterogeneously dense, and D, extremely dense, you can see there's more white areas. There's more fibrous or fibroglandular tissue in comparison to the fat, which is, you know, more black or clear. So why is this a problem? The reason this is a problem is that cancers, when they develop in the breast and we see them on the mammogram, usually they have the same color as that fibrous tissue. They're usually, they'll appear, you know, that white color that we're seeing on the mammogram. As you can imagine, this is a 2D image. So if you do have a cancer that develops that's superimposed, or if there's overlapping fibrous tissue with the cancer, it may be hard to identify that cancer with that fibrous tissue overlying it.
Because they both look kind of white, right?
Yeah, they both look white. So that's why women with the heterogeneously dense or the extremely dense breast tissue, it makes our job harder. Definitely with the women with the extremely dense, where we have more of that fibrous tissue and we're seeing less fat, it's even more challenging to identify cancer, especially these smaller cancers in those women compared to women with less dense tissue.
Yeah, great, great, great. That's such a great explanation. So, so the one thing that you said that was I thought was critical was that you learn about density from a mammogram, right? I can't just like go like this, oh, I have dense breasts and feel my little boobs, right? You have to have a mammogram to identify. Is that correct?
That is correct. And I think Leslie alluded to such a great point in terms of being knowledgeable of what your breast density is. And one of the big things that My Density Matters is doing is educating women how to look at their report and to identify their breast density. So as a radiologist, we are required, especially a breast imaging radiologist who is interpreting the mammogram, we are required to put your breast density in that report. So it's important for women to understand when you get that report, not only to see, oh, whether or not you have a normal or abnormal result, but what is my density? Because there may be some implications based off of that.
Awesome.
Right.
And I have a
Wow, wow, wow.
question for
So,
you, particular to that. So maybe you were going to ask that. Sorry, Ricky, I didn't mean to interrupt you.
okay.
Density, can you speak about density as it's related to Black women in particular? Is there something that particularly needs to be looked after or watched out for those?
Yeah, I think the studies, there are different studies on this in terms of looking to see if Black women more often have dense breast tissue. There are some studies that support that. There are some others that don't show those results exactly. But I think the biggest thing to know, especially among Black women, that they are more likely to develop more aggressive disease. So it is critical that if Black women do develop breast cancer, that we catch these cancers early. And when you are dealing with dense breast tissue, which may obscure a cancer, it's just important to be knowledgeable of that, I have dense breast tissue. If cancers develop, it may take a little bit longer before they become evident to the radiologist reading the scan. So I may want to pursue supplemental screening or additional screening that's a little bit more sensitive than the mammogram. So if I do develop breast cancer, it'll be detected in a timely manner where it can actually be treated.
Right, right. I saw a data point, and I can look up where I saw it, that 37% of Black women have dense breasts. But that number seems a little deceiving, because that means that must be based on women who have had mammograms. And I think the scary part for me is that we have so many young Black women getting breast cancer at later stages, at earlier ages. And the data says that Black women under the age of 35 get breast cancer at twice the rate of white women and die at 3 times the rate, well before they would have had a first mammogram at age 40. And Black women under 30 die at 3 times the rate of white women. And so they have never even had an opportunity to know they have dense breasts, right? And so that 37% number can only reflect the people who have had mammograms. So to me, it's not speaking to those younger women who've never had one and never had it defined, right?
That's all great points, yeah. And we know Black women, on average, who develop breast cancer, they develop it earlier
Yeah.
than white women, as you're alluding to. So definitely great points.
Yeah,
So
I
the
know.
ACR just came out, not just, I think last year, came out saying that all women, but especially Black women and Ashkenazi Jewish women, should be doing a risk assessment by the age of 25.
Yeah.
And so we point people to that a lot. And in fact, the breast cancer screening guide that they're going to be taking at Vanderpool, if they haven't already, incorporates that risk assessment. So that's maybe one way where some
Yeah.
of those women can actually find out their density earlier, because if they
Yeah.
take it and it's over 20%, I'm gonna let you take this, Dr. Miles, after I'm done with this sentence.
Yeah.
If they're 20% or over, then they should hopefully be getting a different look.
Yeah, so if their risk is 20% or over,
Yes,
20%
right.
is bad. That's bad news. I mean, you
It
want-
is.
Yeah, so that's the 1 in 8 number, but yeah, so go ahead, Dr.
Yeah.
Rand.
Oh, yeah, definitely. So how do I get a risk assessment? This is something where you want to go to your primary care doctor and just ask, I'm 25 or whatever age, I want to talk about my breast cancer risk, and can I have a risk assessment? This is something that you can discuss with your primary care doctor, and if they can't provide that risk assessment, they can refer you to someone who can perform that risk assessment. But as many of you know, when you go to these primary care appointments, or even, if you're going to see your OB-GYN, a lot of times you're dealing with so many other issues. So many times your doctor may not necessarily bring this up. So you want to be the one, if they're not bringing it up by that age, to say, I want a risk assessment. If you can't do it, can you refer me to someone who can perform that breast cancer risk assessment? So that's one thing. And as we were talking, as it was mentioned, if you are greater than 20% or higher in terms of your breast cancer risk, then you are someone who qualifies and should start receiving breast MRI screening. Breast MRI is our most sensitive exam. If there is a breast cancer in the breast, we are going to find it with that breast MRI. So it's just a tool that we direct towards those women who are at the highest risk. So that's one component. The other thing I was going to mention is, for women who have a strong family history, it's so important to really be on top of that conversation, and also to educate your family members. So if you have, your daughters, your nieces, your sisters, anyone that, is coming up in age, if you've developed breast cancer at an early age, you want to make sure that they understand the implications of having that strong family history, and that they're advocating for themselves to get that risk assessment, because they may need that breast MRI earlier than, the normal routine screening mammogram that we recommend for all women.
Yeah. One of the things we also recommend for young women, Leslie and Dr. Randy, is the wisdom study. We work with the wisdom study a lot, and with Dr. Laura and Stephanie and those guys, because you can get a risk assessment, a free genetic test. And it's really for women who aren't sick, who don't have cancer, can sign up, and they'll track you over time and help you understand your risk. So, the wisdomstudy.org is really a great tool for tracking for young women. But it's scary, that we just don't have this outlet. And again, you can't decide yourself that you have dense breast. You have to figure it out. But the early detection is all we have. My older daughter, not the one that I work for, but the other daughter, I work for Haley. I know she's my boss, but Amanda, she has my 3 grandbabies. And so last year, about this time, she had a prophylactic mastectomy, because when she had she was 38 then, she had a risk assessment, and at like 35, and the risk assessment told her, which was late for her, especially because we have 3 generations, I'm the 3rd generation of breast cancer, but her risk was like 44% just from the risk assessment. And then she had a mammogram and it went up. Then she had a sonogram and it went up, because they kept finding calcium deposits and whatever stuff. By the time she did the MRI, her risk was like 72%. So she said, okay, cut them off. And so she got new boobs, and she has beautiful new boobs, no scars. She preserved her nipples, and she has resensation. And so, she's like now coaching other young women who have a history to take control of their lives. You know what I mean? But guess what? She did have dense breasts, and she never would have known it because she was too young. It took 6 months to actually get her mammogram for her. To sort of get this process started because of her age. So So, you know, Haley at 32 just had her first mammogram after a fight, you know, and pulling all my strings, right? And she has dense breasts. So she recognized that at 32, but you know, you just have to be diligent, and it's so important to know her story. So important. And you know, our Love of My Girls website, we have a her story worksheet. It's now online, you can fill it out online, but it really helps you sit down with both of your grandmas who may not want to talk about it, you know. You probably have to, you know, cook something with them or something, do something, go to church with them. That's what Haley does when she wants something from my mom. She goes to church with her. But sit down with them and work it out and figure out what her story really is, so that you know at least if there's a risk factor there. But you know, there's just so many things to worry about, that, you know, if you can take this one off the table just by checking yourself, you know, go for it.
Yeah, and let's acknowledge just how difficult it can be to track your family history, you know, because people don't know.
Yeah.
I mean, even when I was a kid, I can remember when a woman had something, it was, well, she's got lady troubles or something like that. And you're like, well, what, you know, so, you know,
Yeah.
and my own grandfather died of cancer, obviously not breast cancer, although some men do. But I can't find out whether it was pancreatic or liver to save my freaking life, because the
Yeah.
story just keeps
Yeah.
going back and forth. Oh no, it was pancreatic. Oh no, it's liver. You know, so it's like, it's not that easy to know. And also, that history is so important. And we need to say that about 85% of breast cancers are diagnosed in women without a family history that they know of.
Oh
or that
yeah,
we
most of
know
them
of.
are. Most of them are.
Yeah.
So yeah, and
Yeah.
you know, it's funny you say that, Leslie, because so many women say, "Oh, my mom didn't have it, so I'm good." That is not the case. You are not good. You are not
Okay.
safe. No
I
one's
thought
safe
that
from
too.
this crazy.
I'm gonna admit it. I thought that too, you know, because it's not in my family. And I might get something else that is in my family. There's stuff, you know, but I didn't think it was going to be breast
Yeah.
cancer, but blow me away. It certainly did happen. What do you see about that, Dr. Miles? Do you see a lot of people really surprised about this?
Yeah, I would say the majority of the women that we see, they don't have a strong family history. They don't have a family member that they know that has developed breast cancer. That's why it's so important, you know, especially if, you know, you're not high risk at age 40 to start getting those routine screening mammograms, because, you know, if we catch it early, I mean, you know, 5 year survival approaches 100%. If we can catch it early, make sure to get you treated with, you know, evidence-based, you know, therapies, you really can survive breast cancer. So definitely get screened no matter what your family history is. Other thing I'll bring up, you know, if you do notice that, you know, there are some genetic syndromes that may increase your risk of different types of cancer. So if you do have a family history of, especially if it's like a high number of family members that have developed cancer, particularly at like young ages, whether it's breast cancer or not, you know, bring it up to your doctor. You know, you know, that may prompt them to do some genetic testing or whatever else, just that so they can better categorize you in terms of your risk profile. And that's just something, you know, we've seen a few women like that where they're like, oh, I had a aunt, you know, diagnosed with you know, a non-breast cancer at an early age, you know, sub 40, or you know, an uncle, you know, like diagnosed with another cancer. And then you start seeing these patterns that, you know, that are hard to figure out, but then they get that genetic testing and you find some genetic syndrome that, you know, that can help inform them getting screening for different types of cancers, including breast cancer.
Yeah, yeah. And they're finding more and more of these genetic
Yeah.
things all the time, right? So it used to, I mean,
Yeah.
BRCA1 and BRCA2 used to that, I mean, Angelina Jolie
That was
brought
it.
that into the,
Right.
you know,
Right.
national everyday conversation, but there's a bunch more,
Yeah.
right?
There's a
Yeah.
bunch more, and a bunch more, you know, biomarkers too that you can test for. You know, I was just in Ghana 2 weeks ago. Gosh, just 2 weeks ago, I was in Ghana, and we were with this amazing doctor, Beatrice Adai. She's a breast surgeon, and in Ghana they have, you know, they have nothing. In her hospital, she has one mammogram, one CT scan, one sonogram, like one of everything, and 4 operating rooms. But she handles this whole area of Kumasi. But she's been working over the years, and so has Dr. Melissa Davis, who we work with our Africa Soundbite Project, and they've identified a gene in Ghana called the Duffy null gene that they believe is attributing to triple negative breast cancer in Ghana, in West Africa. So I could have that gene. I don't know. I have 3 generations. My mom was ER positive, but my mom's aunt died at age 42. We don't know what she had, what breast cancer she had, because it was so long ago. But I could have that gene. Do you know what I mean? Because we don't test for it. And so there's so much science that we don't have that we have to, that's why really, we focus so much on advancing the science and trying to get people to study our breast cancer because it's different. And, we're working on this project, Dr. Randy, the Cancer Grand Challenge with Melissa Davis, Sambai, and, we're seeing how there are major differences in the biology of a Black cancer cell versus a white one. And so there's got to be some role that breast density plays in that equation too, that we haven't identified yet, so much more work to do, but that's why we have to be even more vigilant, about just check them. I tell everybody wherever I go, check the breasts that you love. I know you have a pair. And like men, women, whoever, go do your thing. But it's so important to make density part of the conversation with your doctor, especially if you can get a mammogram. And also, can you speak to 2D and 3D, Dr. Randy? Because we're telling them if you get a 2D, go home.
Oh, no, definitely. There's been just like kind of comment on your last point. There's been so many studies that they really tried to look at these epigenetic components that have kind of probably traversed down throughout the African diaspora, like you're saying, in terms of like these genetic factors that may, contribute or explain why we are seeing more aggressive tumors in African American women and the fact that they're developing them at a younger age. But if this is such a big point, I think, I agree. Let's just like pause and you need a 3D mammogram, the
Say it
3D
again.
mammogram.
Say it again. Say it
You
again.
need a 3D
Say it
mammogram.
again.
Yeah. So if you do go to a place, that's something you need to ask. You need to know that before you actually get the scan. Will I be receiving a 3D mammogram? Another name for that is tomosynthesis, 3D tomosynthesis, but you want to get that 3D mammogram. As a radiologist, it just helps us out so much in terms of looking through that fibrous tissue or that dense breast tissue to see if there potentially is a cancer that is developing within that area. Particular, there's something that we look for. It's called architectural distortion. And what that means is the tissue is distorted. And the way we see that on the mammogram is that there are kind of lines that are coming to a single point. It almost looks like a little star there. And that's so much easier to identify on that 3D mammogram. It not only helps women with dense breast tissue, but also helps women who don't have dense breast tissue. If you remember that picture we showed, even though, the A and B category, the women that have almost entirely fatty breast tissue and scattered fibroglandular tissue, even though the majority of their breast is not dense, they still have areas where there's fibrous tissue. So for whatever reason, if you have a cancer that develops, in that area where there's fibrous tissue, that cancer could potentially be missed. So you want to get that 3D tomosynthesis despite your breast density. It's going to give the radiologist that best shot of interpreting your mammogram accurately. The flip side of that is that the 3D tomosynthesis also helps us to not call you back when you don't have cancer. So by looking at those different slices that we get with the 3D imaging, there may be overlapping tissue that we see on the 2D image that may look like it potentially could be a cancer. But if we have those slices where we can look at each slice of the breast, it may make it easier for us to identify that this is just, superimposed or overlapping tissue of overlapping normal tissue and not cancer. That may help prevent you from being called back unnecessarily, coming back to the breast imaging suite on another day to have another imaging study that ultimately determines that you don't, have a suspicious finding. So it's going to help in both ways for us to identify those small cancers and also to prevent from calling you back for something that's not cancer.
Yeah, great, thank you. And I have a question about that, let's take that scattered fiboglandular breast that we were looking at
Yeah.
before. Do you see that it's more likely that if that person were to get breast cancer, that it would be in the white area, or is it everywhere?
Breast cancers can develop everywhere. We do commonly see them, within the breast. We do commonly see them in some areas. A lot of times if you look at some studies, the majority of the time we see them in that upper outer quadrant to a greater degree. But in those areas of fibroglandular tissue, we often see that's where the breast cancer develops, unfortunately.
Got it.
Wow.
That
Yeah,
makes sense. And that sort of just exacerbates the problem, doesn't it?
it
I'm
does.
hiding out in my.
If you've got a whole breast that's, mainly fatty, and then the cancer winds up in the part that's not, that's the scattered. Wow. Okay.
Exactly.
Well, there must be something about that then,
Yeah,
like,
exactly.
right? So a doctor friend of mine say, well, there's only one really rare form of cancer that forms in fat.
Yeah.
It needs something else to form, right?
And that tissue, that fibroglandular tissue is very, that's very hormonally active. And I think, like some of the going down those same lines of thinking where we think about these breast cancers and their receptors and all that, it definitely makes sense why we do commonly see cancers when they develop in that fibroglandular tissue.
Yeah.
So Dr. Randy, what if I was a little chunky, right?
I
So
wouldn't say, if me personally, Ricky, I wouldn't say what if.
all right, so I think I would just make the assumption that I had fatty breasts.
Mhm.
Did I make that assumption? No, right? And I'm hiding out in my daughter's house with my 7-year-old granddaughter sneaking around behind me. Say hello, Belle. I was trying to hide, but I knew she would find me. This one would find me. There's two more that we won't tell them we're here, right? Okay, go ahead. I'm sorry.
Oh, no.
So I
Well,
shouldn't assume that because, right, I still could have dense breasts. Hello, right? It doesn't
yeah.
really matter how much you weigh or what your BMI is to affect your breast density.
Exactly. We do know that there is an association. Women with a higher BMI generally have more fatty breast
Okay.
than women who have kind of a lower BMI. So that is an association we know, but it's something you would never be able to tell by feeling the breast or whatever
Right,
else.
right.
Yeah,
Again, the only way you know you have dense breast is to get a mammogram, right? Is to get screened, a mammogram or a sonogram or some kind of radiology tool. Is that correct?
on
Okay.
that mammogram, we'll be able to tell you whether or not you have
Okay.
dense breast tissue. And we are required to, honestly, by law, we're required to put that in your mammogram report. So if
Right.
you've had a mammogram and you're wondering, do I have dense breast tissue? It's on that report. If you're unclear, ask your provider, can they help you identify where it is on that report? Or one thing you can do is visit My Density Matters, because there's resources there as well that tell you how to look at that report and identify your breast
Right.
density.
Yeah.
Great. MyDensityMatters.org. And you guys, I'm having a little meltdown on my iPhone where I usually track the comments, and Facebook is not in, so I can't really see the comments people are writing online.
Yeah.
I'll try to step away and do that on my computer, but I'm not sure why Facebook is having a meltdown today. It often is. But
It's
I do have
always
one
something.
comment I can
but
make.
do we have any questions from the event?
I don't know. I think they were trying to do it through the comments, Ricky, that you
Oh,
can't,
darn.
that
Okay.
you can't
All right.
see.
I'm
I'm
gonna
not
go on.
getting anything texted to me, so I
Okay,
think
I'm
that,
just gonna go on mute for a second because sometimes
Okay.
there's back, and I'm gonna go try to look on my computer for the Facebook, but you guys keep
Okay.
talking.
yeah. So Dr. Miles, I have a question for you. Beginning of this year, 2024, the ACS, American Cancer Society, came out with some really kind of gut-wrenching statistics, I thought, about people getting cancer younger, but particularly younger women. The headline of the article was "The New Face of Cancer, Young and Female." Talk to me about that.
Yeah, it is a trend that we are seeing more and more. It may be that, our tools are getting better at identifying cancers. It may involve, other environmental factors such as diet, the specific activities that are occurring. But just anecdotally, I think all of us in breast imaging are very surprised that we're seeing more and more women, especially in the breast cancer space, develop these cancers early on. And it does bring up some important points that I would love to talk about. Let's say you are average risk, you're not at the age of 40. If you do feel a lump, if you notice any change in the breast, color, pain, anything like that, nipple discharge, especially if it's bloody, this is something you want to talk to your primary care provider about and discuss with them your symptoms, how long you've had them, because you may need you may need imaging. You may need to come to the breast imaging suite, especially if you feel a lump, we want to see you, in the breast imaging suite. We want to make sure we can do an ultrasound, make sure that there's no suspicious findings within the breast. If you're having bloody nipple discharge, we want to, be able to perform imaging, especially because women are developing cancer early. So you may not, have even gotten to that first routine mammogram, but you still can develop breast cancer before the age of 40. So if you feel symptoms or if you have symptoms, let your doctor know so you can get imaged prior to that time period. And for women that have gotten screened. So, I want to point out that, mammograms are very sensitive. We are very good at identifying cancers on mammograms, but there are certain cancers that can be what we call mammographically occult, meaning that we may not be able to see them on your mammogram. And sometimes the breast density is a reason that we're not able to see those breast cancers on your mammogram. So, let's say you do get a negative mammogram or a normal report for your mammogram. If it's 3, 4 months later and you feel a lump or you're experiencing discharge, I don't want you to say, "Oh, I just had a negative or a normal 3 or 4 months ago." We You are feeling a lump, you are having discharge because one thing that a new cancer could have developed over that time period, or there could be a breast cancer that's, in that breast that could potentially be mammographically occult, where, if you go for that appointment, they potentially could add an ultrasound to that study and identify an answer that potentially was hiding on that mammogram. So definitely develop those.
Hey, Ricky, you are muted.
Whoops, I'm good, I was muted. That was another, that was a grandniece that came to, that was Riley with Beth. Sorry for the distraction. And they're
Yeah,
here.
so I want to just say, I want to piggyback off of what Dr. Miles
Okay.
just said. Get it looked at. And I want to add, don't give up until you're satisfied. Don't allow yourself to be dismissed. We get dismissed a lot, especially I hear these stories of younger women getting dismissed because people will say, "Oh, but you're too young to get breast cancer." And nobody's really too young to get breast cancer. So that's
No,
back
nobody
to
is too
advocating for
young.
yourself again. That's back to saying, "Hey, I feel something and I want to know what that is. I will not be dismissed until we find out." And that's what we need to do. Sorry, Ricky, go ahead.
Yeah, we have a comment on Facebook from Sherry Gibson. I'm not sure if you mentioned it, but I'm 22 and it's been difficult for me to find resources to get a mammogram. How do you think a younger person could find those resources? I want to ensure I'm active in my health, especially as a future physician. Hey, Sherry. So that's what we just talked about,
Yeah. What would you recommend, Dr. Miles, to her? Start with a risk assessment? Is that what you would do?
Yeah, well, first I would say start with I mean, you guys are part of and lead such amazing organizations. So I would start with, you know, advocacy groups and organizations, just to learn more about, this topic. I
Yeah.
think second, would be talking to your provider, and really going through your risk profile, telling them about, your concerns because different areas Leslie, you mentioned this before, like it's different depending on what state you're in, based off the laws, depending on how it based off practice patterns. So you kind of want to understand how your provider views it. But
Yeah.
also you want to be informed and in a position where you can advocate for yourself. And that's what makes these advocacy groups and these organizations
About
so helpful.
people getting cancer younger, but particularly younger women. The
Oh,
head
we're
of
getting
the
some
article was
feedback
the new
on
face
there.
of cancer, young and female. Talk to
That
me.
was like 5 minutes ago.
Yeah, and that we are seeing more and more. It may be
What's
that
happening, Ricky?
are getting better at identifying.
This article was
Sorry.
the new face of cancer,
Okay,
young and female. Talk
that
to
was
me.
5 minutes ago. Okay. I have a question for Dr.
Yeah,
Miles.
sorry about that. That's what happens when I try to go to the comments
Yeah.
on my computer. Sorry.
Okay, that's okay. So we talk about additional imaging for women with dense breasts, you know, like we talk about all the time. What are they? And can you talk about, just give, you know, a brief description of what these things are that we're talking about, and how effective they are, and how to get them, and what they're like, and all that.
Yeah, so probably the most commonly, so I mean, I think we previously considered like tomosynthesis as something that was supplemental, but I think nowadays, like tomosynthesis it's so widely available and we're using it with screening. I would say that's the first step. Get the 3D tomosynthesis. If the breast imaging center you're going to get your screening doesn't have 3D tomosynthesis, try to find somewhere else that does have it, and to start there. In terms of the most commonly used supplemental tool, it's whole breast ultrasound. So, you know, whole breast ultrasound is amazing because we can actually look through that dense tissue. So, you know, breast density does not impact us in terms of interpreting breast, you know, in terms of interpreting your breast imaging study. When we look at ultrasound, there's something that's called automated breast ultrasound that, you know, basically is your whole breast ultrasound, where a lot of breast centers have, where you come in, you know, you get that, you get the whole breast ultrasound, and then you're able to leave and then just kind of wait for your exam, for your report to be complete, and to understand, you know what your result is for that day. So whole breast ultrasound is probably the most popular and most widely available, very useful in women who have dense breast tissue. And many times with these tools, they can put you on a schedule where you can get your mammogram at day 0. And then 6 months later, you can get your supplemental imaging tool like ultrasound. So it just helps to make sure that you're getting breast imaging every 6 months. So if something does develop, you shorten the interval in terms of when it's identified with screening. Another tool is breast MRI. You know, a lot of centers now are offering a abbreviated form of breast MRI that they are offering to women who have dense breast tissue. That is probably our most sensitive tool. You know, anything you know, that we're giving contrast, such as like a breast MRI, is going to be very sensitive, just because we're able to take advantage of the fact that we're giving contrast and we can see vascular properties of findings that develop in the breast. So that tool with breast MRI, target that to women who are at the highest risk. And the reason that we do that is because breast MRI is very sensitive. It identifies pretty much all cancers, but it also identifies things that are not cancer. So sometimes it can lead to, you know, additional imaging or additional biopsies for findings that are not cancer. So that's the reason we typically target that to women who are at the highest risk, because if we do find something in their breast, you know, it's more likely to be cancer compared to women who are at a lower risk. But definitely these abbreviated protocols are shorter and are available now, you know, now so for more women who just may just have dense breast tissue and who may not be over that 20% threshold. There's another technique that's becoming more and more popular. It's something called contrast enhanced mammography, where we actually give contrast to women who eventually have a mammogram. I think this is going to become more and more popular. I think this is really something over the next 5 years we're going to see really grow, and especially be utilized more so in women with dense breast tissue. But it's the same study. You receive your standard images for your mammogram, but we give contrast before. And that just allows us to take advantage of the vascular properties of tumors if they are there. So when cancers develop in the breast, they're very vascular, and they take up blood flow very quickly, but they have very leaky vessels. So they demonstrate this property that we use in medicine called washout. So the contrast comes in rapidly, but because of these leaky vessels, it kind of leaves the mass pretty quickly. So when we look at MRI and contrast enhanced mammography, we're able to take advantage and be able to see evidence of that property in tumors. So it gives us a little bit higher sensitivity when we're identifying these tools. But I would say for women right now, probably the biggest tool or the most widely available tool that you probably should be advocating for if you do want to get supplemental screening or additional screening on top of your screening mammogram, if you do have dense breast tissue, is whole breast ultrasound or ABUS imaging.
So
Okay.
whole breast ultrasound, you guys, whole breast ultrasound. I'll put some of these comments in the chat after we turn off so we won't get the feedback. But, I think at the end of the day, though, it's what you said very early on, Leslie, about advocating for yourself. And especially if you're young, if you think something's screwy or you really want to check it out, you have to go to the doctor. And, we tell everybody to go, you go back to that doctor and you say, what would you do if I were your daughter or your auntie or your cousin or part of your family, right? To get the care that we deserve, because we're getting dismissed, all ages, but especially our young ones. Oh, you're okay. You're too young. Don't worry about it. And that's not the case at all. I can't get rid of my little people. Sorry.
They're very interested in what you're doing, Ricky. Yeah, that's okay.
Always,
Hey,
always.
they're gonna grow up knowing a lot more about this than the average person, just because they're creeping
Yeah.
around your
I know. Well,
shoulder.
it's so funny. I think Belle's first conversation with me about boobs was we were in the shower one day. She was maybe 3.5, 4. Her baby sister was a nursing. And I have implants. And so she said, Debbie, how come you don't have those things on your boobs that baby heart sucks on? So we had that started our conversation about breasts, and then recently she was watching the Super Bowl with her father and saw have you seen the Incredible Novartis?
Oh yeah.
I helped them a little bit with that. So that's what Debbie does. So that's pretty cool. I thought maybe we could even end with that commercial because I think it's so well done, but let's keep talking. So now I have a room of little girls.
Yeah. Excellent. I want to do just one more shameless plug for the challenge that we have going on now. So
yeah, we haven't talked about the challenge.
About the challenge. I know. Let's do that. So, this is our 5th annual Find Out My Breast Density Day. It was actually the 19th on Wednesday, but this year we're kind of extending the challenge from starting on the 19th through International Women's Day, because that's an important day too. And so it's very, very simple. And I'm sure that Dixie's going to put the links and everything in the chat to do it. But it's just a very simple, like 2 or 3 question quiz that, do you know your density or don't you? It's for everybody, not just anybody who doesn't or does. And then, you'll get an email with a bunch of resources relative to what your answers were. And so we just want everybody to learn more, like if you haven't had a mammogram and you're 40, what's the first thing you're going to do? Get that mammogram. If you've had a mammogram but don't know your density, learn your density. If you know your density, but you haven't advocated for yourself, advocate for yourself, right? So imagine if everybody just moved along one step, what a difference that would make. And so that's kind of what we're trying to get people to do. So it's the Know Now Challenge. It's our 5th annual Find Out My Breast Density Day, which was really like 2.5 weeks. And we're just trying to educate everybody, and we're trying to be creative, do things in a fun, different way.
Yeah,
so
things differently.
do things differently. You
And
can
they can
also
go-
text. know now. at 2114.
MyDensity.org, right?
Yeah, yeah, it's
I'm sorry,
right on the front.
Yeah,
And you can also
MyDensity.org.
text, know now to 211-411 and get there that way too. So,
Say it
trying to
again,
make
text
people aware
know
that-
now, KNOW now.
No,
Say that-
KNOW now, right? So it's a little play on words there, right? No now to 211-411, and you'll get a bunch of resources and the challenge. So
211411.
211-411.
Text know now.
Yep.
Great.
211-411.
All right, great.
Yeah. So yeah, that's what we're all about. We want everybody to know their density and know how to advocate for themselves. And we envision a world where breast density no longer hinders the early diagnosis of breast cancer. That's really what we're after. So that's the day My Density Matters packs it in and just goes to hang out at the beach with, pina coladas and margaritas and declare success. But we have a long way to go. And so we're working. So that's us. Thank you,
That's
Dr. Miles,
great,
for being
great.
an amazing medical
Yeah, thank-
advisor for us.
Yeah, thank you so much. And for he's showing how much love he has for his work in our audience too, and the patients that
Yeah.
he sees, I'm sure.
Yeah.
Dr. Mo said, I'm going to treat you like family, and I feel like that's how you're treating us, Dr. Randy. So thank you for all of your good work and support and love for patients, there's so many things we have to teach, Leslie, women, and it amazes me every day. I don't know why, but people are struggling.
Mhm.
Those are Skittles that Heart is hiding in a drawer. Heart, come here. She's hiding him in a drawer. She hides candy all over the house. Sorry, but do you mind if we show that Novartis commercial? Do you want to show it? Because I think it's such a great screening commercial. Have you seen
Sure.
it, Dr. Randy? Have you seen this commercial, the Super Bowl ad? We kind of,
We'll get your reaction after we come back.
yeah, we'll check it out.
Okay.
You can tell us what you think, but it's interesting, approach to how to talk about it. And I think, what I love about it is that we're talking about boobs that have been part of our life our whole lives, right? Can you pull this up? No, you guys.
That's it. Yep. Hey, Ricky, I think you got to share it with sound.
Okay. Whoops. Are you not seeing it?
Seeing it, but not hearing it.
Okay, let me see. Hold on. You know what? I'm gonna put it in the comments
Okay.
because I'm sharing it from YouTube and I don't know how to do that. So we'll put it in the
Okay.
comments. Everybody can take a
No
look at it.
worries. Yeah.
But it's your attention, please. And it shows a lot of pictures of, women with boobs in all different situations. That's, they're part of our bodies. And we spend our whole life either getting looked at or trying to hide them or trying to pronounce them, changing bras. And so, but are we really giving attention to the health of our boobs? And so that's so important. And so that's what this conversation is all about, understanding, and it's not just about getting that mammogram, which we need to do it. We need to do it, but it's understanding what it means. And do I have breast? What does that mean for me as a risk factor? And should I get more screenings? And should I, be more diligent about asking for more help for my boobs? And the other thing, Leslie, and if you want to give your email address, but anyone can always email me, Ricky, RICK@touchbbca.org. We will help you. We'll send you to Leslie. We'll send you to Dr. Randy. We'll figure out where you need to go, but we will try to be that resource for you to get you the help that you need. If you want to, we FaceTime with many doctors. I've been thrown out of several doctors' appointments. Offices on FaceTime.
No.
But we'll FaceTime with you. And yeah, I have, and I'm cool with that. But we're happy to help you have these conversations to make sure that you're getting the information that you need. We can help you prepare for your meetings with your doctors. And so, Dr. Randy, you're now sort of in my family. We don't let you go once you're in our family. We'll ask for
Yeah,
help.
it's like the Hotel California, right? You can check out but never leave, right? You're
Right.
you're in, that's it.
Right.
Yeah, and we have resources on our website as well, you know, guiding to how to talk to your physician, common pushbacks and what you might say in response to that pushback, etc. So, again, all part of advocating for yourself or what you need. Yeah.
Yeah, advocate for yourself, stand up for yourselves, and any closing words of coaching, Mr. Randy?
Yeah, I mean, I loved, I don't know who stated it, but just feel comfortable, you know, with what's going on. You know, if you're advocating for yourself and you don't feel comfortable, you know, advocate more or, you know, talk to another provider, you know, look at the resources provided by blackdoctor.org or, you know, like many of these organizations that really help you get to a point where you do feel comfortable because, you know, it's your body, it's your health, and it really should be kind of a shared decision-making process to get to a point where you're not only receiving the best care possible, but you feel like you've been involved and you feel comfortable with the result. So.
Right, it's your body. We always say, be the CEO of your own health. You know, take control of it and direct traffic, you know, and if you don't feel comfortable with your doctor, we'll help you find another one. And, you know, we'll call Dr. Randy. We'll call you. We'll go to Denver. We'll do what we got to do.
Everybody's going to Colorado anyway, so they might as well just see Dr. Randy, right?
Yeah. But thank you guys so much. Leslie, I love doing this show with you every year. We should do it more often.
Me too. Yes.
And,
Thank
and
you
we
for
should talk
hosting us.
about it anytime,
Really
you know,
love it.
we'll always talk about density, and it's an important thing.
Yeah.
And check your breasts that you love. I know you have a pair,
Yeah,
Yeah.
I know you have a pair.
right? Work it out, right?
Yeah.
All
Yes.
right. Thank you guys. I'm sorry for the
Thank
grandchildren.
you.
Yes.
No, it's all
But-
right.
Blessedy, love my Blessedy. Take care of yourself. Thank you, Dr. Randy.
You. See you soon.
See you soon.
Bye,
We'll see you
everybody.
next week for our regular episodes, and look out for all kinds of stuff on Triple Negative next month. March is starting. It's Triple Negative month. We're going to be on a lot. So
Good.
talking about it. And, you know, we need to talk about lobular too, you know. I was with Mo yesterday and we were talking about lobular because that's what her grandmother had. And so guess what,
Yeah.
back then, it took her so long to get diagnosed. So that's
And yeah, it's often diagnosed later because, you
yeah,
know, you
there's
can't
no lump.
see it and
Yeah.
it's no lump and
Yeah.
yeah.
So that's another topic we'll
Right.
talk about, girl.
Yep.
All right.
Okay.
Thank you, everybody.
Bye.
Bless you.
Bye, everybody.
Thank you. Bye.